this is tracheostomy clean. So the first thing that we're gonna do is check our physician order, and then we're gonna gather our supplies. We're gonna identify our patient. I'm gonna tell them what I'm gonna do, and then we're gonna go ahead and wash our hands, put on our gown, a face shield, splash shield, and our gloves. Wash my hands. I do not have a shield, so I'm gonna use a mask as my shield, just for purposes of my face shield, splash shield on, splash shield, and then I'll put my glove on. Alright, now I want to remove the soiled sponge from patient. Taking this off, just starting it in the trash, and then if it was super soiled, we might have to put it in a biohazard bag. But then we're going to pre-oxygenate the patient. We're going to ask them to take 5 to 6 deep breaths, or we could use a resuscitation bag. He's going to take 5 or 6 deep breaths. And his oxygen supply here, I'll move to the side, but I'll make sure that the air is flowing towards the cannula. Still getting that air. All right, ready to get started with this, so we're going to take our gloves off. And wash our hands. And then we're going to get our supply set up. So for the purposes of this, this is my peroxide. I don't have any peroxide. And then this is going to be our saline. So we would open our supplies away from us. I'm going to go ahead and remove out my sterile gloves and put them over here. And then we're going to get out this top part. This will be our sterile field. We only touch the outer 1 inch, and we want to lay down the shiny part. So lay it down there, and then we're going to take the contents and try to carefully dump them into the center of the sterile field, and not touching the sterile field. Okay, and now we're going to go ahead and get our solutions ready that we'll be cleaning with. So for our normal saline, because it's already been opened, we're going to check the date, lip some off into the trash, and pour some in. Same thing with our peroxide. It's been open, we would check the date, lip some off, pour into our tray here. And now we need to put on our sterile gloves. Only touch the outer 1 inch border. Now, all the time that we do this procedure, the dominant hand is going to stay sterile. This will be the hand that I use that's can get dirty. This is going to be little sponges that we can use to clean with. And this will be what we will replace at the end. This will be what we use to clean the cannula. These we will use our little pipes to dry, and we will replace the tie at the end. These are our Q-tips to clean the face part of the cannula. Okay, so now, I'm going to go ahead and break sterility with this hand. So I would pull out the inner cannula, and if it's real soiled, I'm going to put it in the peroxide. If it is lightly soiled, we could put it in the saline. So we're going to let it soak, and then we would, put it in the saline at the end. So then we would take our sterile hand with a scrubber, and we could go ahead and scrub, get all the stuff off of it, and then we discarded that into the trash. And then we're gonna take our pipe and dry it really good. Part of that. And once that's good and clean, we can, and dry, we can go ahead and put it back in. And then we would take, our little Q-tips here and put them in the saline, let them get wet. And if we wanted to use these little gauze over here, we would need to fold them in so that our sterile hand would not touch anything, and we could dip that in and use that to clean if we needed to. We're not using that. Okay, so now we're going to take our Q-tips and we would clean the face, we went outer to inner, and we only use them for one wipe, and we throw them in our trash. Then, when we're done with all of that, now we need to put on our new dressing, and we want to make sure that our hands do not touch the inside, especially this hand that's been over here. The sterility is over now. We just didn't want to touch the inside of that. Now what we've got to do is we've got to change out these strings. So what we want to do is we want to be sure that we do not take off the other strings before we have these on, and we also want to make sure that these have slip knots in them so that they can come off easily. And once we have those on, we can go ahead and take off the old one, and then we're done with all of that. If the patient was ordered to have oxygen back, we would put that back at whatever the order was. When we take off our gloves, wash our hands, and document.